All right, so I'm going to talk about today the three most common types of low back pain that are seen in physical therapy and in my clinic. In my clinic, I actually have one more. It's a fourth kind, and I can go over that as well. But if you are having back pain, I would encourage you to check out the events tab, events page on this website. If there's not one of those, it'll be right below the video here. About once a month or so, I host a low back pain workshop at my facility, which kind of walks you through a little bit more of what I'm going to detail today and how you can get your life back without taking nasty drugs or getting injections or having to go down the road of surgery. Even if you've been to physical therapy before, if you've seen chiropractors, massage, acupuncture, and the treatments they're helping, but maybe they're not helping as much as you would like, and you're still having a hard time trying to get back to the things that you love, I would encourage you to check out one of these workshops. I think you'll be enlightened, and I think that we can really help you out. So check out the events tab or the page or right below the video here, and I hope to see you. But starting with this, the most common form of low back pain that I see in the clinic, number one is a herniated disc. Herniated disc. Okay. Now I want to go through this a little bit, okay? What is a herniated disc? Well, it would help if I drew out a little structure here, and pardon my artistic skills, but okay. Boop, boop. Okay. All right. So if we are looking at this is the back. So this is the front side. So I would be standing here like this. Okay. So my back is here and my abdomen is here. So abdomen on this side, my back is on this side. This is bone, or your vertebrae. Okay, and this is bone as well, and in between those two bones is a cushy kind of material called your disc. Now, the disc is kind of like a jelly donut in the spine. It is kind of like a jelly donut, whereas if you squeeze on one side of a jelly donut, you'd expect the jelly to go towards the opposite side. Well, that's true of the disc as well. It's got this jelly or water-like material on the inside, and then there's harder tissue on the outside. And over a lifetime of bending forward, sitting down at our desk, lifting things up, bending down to tie our shoes, pretty much the things that we do in life, we always end up pretty much compressing down on the front portion of the disc, and slowly it moves that jelly towards the back. Now, that's important because running down through here is your spinal cord, okay? And then coming out of your spinal cord are these spinal nerves, okay? Like that, boom, boom, okay? Now, if this jelly gets pushed out the back and it breaks through those hard fibers of the disc, it can be a disc bulge or a disc herniation. What happens is it impinges on these nerve roots, or it compresses against those nerve roots. And if you get anything that touches that nerve root, it sends pain so you can get a sharp pain in your back, and that pain can also run down your butt. It can less commonly run down your groin, but it can cause numbness, pain, right down your leg. And oftentimes what people describe is a line of pain that they can trace with their hand, line of pain that comes right down their leg. This usually happens in people that are around 35 years of age, maybe just a little bit older, a little bit younger too. So right around there, they're still active, but they started to work more. and they're constantly in this flexed position. And positions that make you bend forward are going to make you worse. Positions that have you extend backwards generally feel better. So some common things are it hurts when you transition to stand up, but it feels better once you're standing, and even better once you're walking, and even better, I should say, when you're walking. Walking is a form of extension at your back. It forms this. So if I was modeling this thing here, it would be this. So extension usually makes you feel better. And it is the most common thing that I see. I see it in rowers. I see it in lifters, weightlifters, CrossFitters, people that just work at a job where they're at a computer, and their body position gets compromised, and they start to round out their back. So this is the #1 source of low back pain that I see in the clinic.